there, good morning. Just hopping on live. We're gonna start a weekly frequently asked questions series. So these videos are for you guys. I just have a lot of information in my head that I've received from teachers or just my experiences, and I want to share it and pass it on to you guys. So this topic this week is on healing. Next week I haven't made the topic yet, so if you have suggestions or burning questions about a particular topic, please just comment below, and I'll start to organize them for next week. And also, if you have questions for this week, as we talk, I'm gonna approximately, we'll see the timing, how it goes, maybe 9:20, maybe 9:30ish, but please ask your questions now. I can see them in the comments. If I miss your question, then just leave it, and I'll write a message to you later, or bring it up in future videos, or just reply right there. Also, if you are watching this on replay, please ask your questions still. You can even hashtag replay where you're watching this from, and I'll get to your questions later, because again, this is for you guys. So if you don't ask questions, then it's more about me because you know, your questions will drive the topics and the conversation. So I'll just start. One of the, you know, when it comes to healing, right, whether it be low back pain, a disc injury, a neck thing, very physical, maybe it's more all-encompassing, such as cancer, or an autoimmune disease, right? We all can ponder, because so I've been healing, as some of you know, from a surgery, and I've been reading a lot of books about how to enhance my own body's blueprint, my own innate healing, so to speak, and also prevent future occurrences. And there's a lot of really great insights in the literature these days about how we can promote our own healing, right? Unfortunately, as healthcare providers, so whether we're a physical therapist or a yoga teacher or a medical doctor, all these kinds of things, sometimes our language, whether we write it in books or in posts, blogs, or, you know, when we're one-on-one with a patient, can really affect how a client or a patient will interpret what they're saying, you're saying, and integrate it into their system and their belief system. So for example, I'm reading in a lot of books about how environment and lifestyle can really either increase your risk for getting injury or disease, or significantly decrease it, which is huge in our society, because we have a lot of control. It gives us a lot of control over things, right? But on the other side, when something happens, when someone gets sick, right? For example, a lot of people don't imagine cancer at 38 years old, right? For example, a patient or a person can look within, and if they're reading all this kind of stuff like change your lifestyle, change your diet, change your thinking, you know, a question comes to mind, and it is, you know, did I cause this disease? Did I cause this injury? Is it all my fault? And then we take on this burden of a blame, right? And there's a shame to it, and embarrassment. As a yogi, as a healthcare provider, I should know enough to have prevented this, right? I'm at fault, and that doesn't help healing at all. In fact, that really slows down the healing. So when I'm reading books and I'm hearing about all this lifestyle stuff, it's taking a step back and reflecting upon your life and say, what's in my control? What can I change? You know, we're only human, and we all have imperfections. There's something that each of us can change. There's something that each of us can improve upon, right? However, we shouldn't beat ourselves up over that, right? Each and every one of us, even if it's a fancy movie star or a really evolved yoga teacher, meditation instructor, doctor, stay-at-home mom, right? We all have something we're working on. And that's part of life. That's part of the evolution. That's part of healing, right? It's part of being human. So we need to accept where we are, right? Be grateful. Gratitude practice is huge for all that's given to us right now. And then from there, we can say, okay, what's in my control? What can I change, right? So I'm making my small changes in my life, whether it's just refining my meditation practice. That can be a topic at some point. So if you want to learn more about meditation, just hashtag below. Refining my yoga practice, moving from right now a more vigorous practice to more restorative and pranayama and meditation in nature, more therapeutic. Working on my diet. More importantly, I'm really observing my thoughts. I'm noticing for me, it's all in the brain, right? So these are things that are inside my control that I can work on changing. At the same time, not beating myself up for what happened. The same is true for low back pain or a disc thing. We go through the similar thought process, like how did I get here, right? I just was bending over to pick a pen off the floor, and all of a sudden now I can't move, I'm locked up. And you know, the books I'm reading, my physical therapists say it's my fault because I didn't stretch enough, right? So some of those things are inside your control. Some of those things are not, like for me, if you have a gene thing, or if you have scoliosis, right? That's gonna predispose you to being at higher risk for disc injury or something of that nature, right? So letting go of what's outside of our control, accepting our imperfections, even loving our imperfections, and being grateful and happy or experiencing santosha and contentment wherever we are right now, all helps to speed up the healing process, right? When we get down upon ourselves and get in this negative self-talk or despair or feel hopeless or that we don't have control over anything, that actually delays the healing process. So that takes us to the next frequently asked question, and that's how long does healing take, right? So from a physical standpoint, physical therapy standpoint, from a science standpoint, from a physiological standpoint, each tissue, whether it's disc or bone or fascia, cells, skin, each tissue or structure in the body has an approximate time that it needs to heal. For example, bones, 6 to 10 weeks, right? And, you know, even though we want to make the process go quicker, I tell a lot of my patients this. It's kind of like watching paint dry. There's nothing really you can do to speed up the process. Yes, you can put fans on it, you can open the window, but it's still gonna take a set amount of time. And you can slow that process down by trying to add a second coat and making it wetter, or you can speed it up by opening the doors and all the windows. So the same is true for ourselves, right? Let's say we're healing from a surgery and the surgeon says, okay, you need 4 to 6 weeks of doing nothing. In our society, that's like the worst news ever because we always have all this stuff to do, right? But sometimes it's what we really, really need the most, and it's really, really hard to do. I mean, right now, I'm on almost week 3 of my surgery, and I should be still doing lots of nothing. And if you've seen me in my yoga classes, obviously, I'm not there yet. So I'm not really the best patient, but I'm learning from it. I really did slow down more than I have been, and that space of quietness and stillness has actually sparked a lot of creativity, which is what gave me the ideas to do these frequently asked questions series. We'll see what comes out of it. But you know, the same is true for you. So you have this set amount of time, depending on what structure is injured or what's going on in the body, that the flu is going around, right? You have a set amount of time that you need to heal, and you just have to respect that and go with the flow. However, there's things that can speed it up, your mindset, whether you actually do slow down or not. There's things that can slow it down. If you go still, if you get caught in this negative cycle of thoughts, if you don't treat yourself well, all this type of stuff can slow down the process. So sometimes you usually, hopefully, find yourself in the middle ground of healing where the tissue heals and then you slowly feel better. And it's not so much like a light switch with, you know, all of a sudden on week 6 you wake up and you're like, okay, surgeon said week 6 I'm back to running, I'm back to jumping, I'm back to doing crazy back bends following my cesarean. No, it's more like a dimmer. So you slowly dial back in the activity and so forth. And if you feel yourself doing too much, then you back off again. So it's playing the edge, as we yogis say. And essentially that's what I work the most upon with a lot of my patients is dialing up the body's innate ability to heal, giving it the space to heal, and then slowly increasing the activities that you want to return back to. So for me, it's yoga and teaching and working and all this kinds of stuff. So if you have any questions so far on any of this, please comment below. I would love to hear. You know, yourselves with healing, how long, I'll ask you guys, you know, how long do you expect or think something should heal, right? Because something is your own belief. That leads us actually to the next question, which I get asked a lot frequently as a physical therapist is, will I heal, right? Sometimes when we're in it, when we're in this box of healing, so when I had my disc bulge with nerve pain, and I even had weakness and tingling in my foot and all this, and I was a good 6-8 months into my healing. And, you know, some days I would feel better. However, some days I would still feel the tingling, especially if I had to drive for long periods, that sort of thing. And I kind of wondered, I doubted, you know, am I going to heal? And that doubt, that lack of confidence in your body, in yourself, can really slow down the healing. So all of us, whether we have certain predisposing factors or, again, this perfect ideal slate, I guess you could call, for healing. All of us have the ability to heal, right? The length of time is dependent upon this multitude of factors, what's going in our body, what's going on in the environment around us, and our thoughts, all these things. But we all have the ability to heal. It's when we take a step back, and I talk with some of my patients, it's actually determining if you believe you can heal. Right? If you trust the person you're working with to guide you along the way, because truthfully, if we're going through something, we should all have someone, a third party, objective person, because family, sometimes, you know, things get muddy. We should really have a person or two to help us in our healing journey. So I have my people where I bounce my thoughts off with. I have a team of people that I like to work with, and for my patients, I try to hold the space of healing, right? And it's that trust you have with the person that you're working with that's going to really increase your belief in healing. So there's studies out, some of you may have read them or heard about them, that, you know, for surgery, there's a few different studies. So we'll take the one of looking at doctors, healthcare practitioners. patients had the best outcome or most success following their surgery. And it didn't matter upon the surgeon's experience or method that they use or any of these things. What predicted the best outcome was the patient's trust and rapport with that surgeon. The same is true whether we're a physical therapist, whether we're a yoga teacher, whether we're a doctor. It comes back to the relationship that we have with our patients that will help either speed up a patient's healing process or kind of halt it down, slow it down. So again, coming back full circle from where I started, our language with our patients and ourselves really matter. The other study is the methodology, right? So not even the patient's or client's belief and trust in that person is important, but, so a question I get asked as a physical therapist and a yoga teacher, okay, so what's better, physical therapy, chiropractor, acupuncture? Is Pilates better than yoga, right? And I always tell them, I'm like, it doesn't really matter. Of course, I'm biased. I'm going to say physical therapies, I'm not going to say better than chiropractic because I have a lot of chiropractic friends that are very, very good and very holistic, right? But I am biased because I'm a physical therapist. So, acupuncture, right? Pilates. I go to see a chiropractor every so often. I go to the acupuncturist. It doesn't really matter. What really matters is the person's belief in the style, the modality that they're choosing to pick. So same with yoga. There's like all these different lineages. None of them are better than one or the other. They just might be more appropriate for that person. Or if that person has a specific belief, like, oh, I've heard from my grandmother and she used to use an acupuncturist and it healed her or assisted her in healing for years in this stuff. So that person's going to have a really strong belief in acupuncture and they're going to, get better results because they believe in it. If someone walks in my door and they're having doubt upon yoga and my crazy yoga wall system, the first thing I have to do is try to establish some education to improve their belief and confidence with what I'm doing, because otherwise, I can do all these fancy kind of healing stuff and it's really not going to make a difference. So belief upon with the healthcare provider, super important, and then belief upon the methodology that's being used is super important. And those can change, obviously, depending upon the relationship and education. So education is huge. It's the same with, the oils, like whether someone believes in it or not. Like, I believe strongly because I feel an immediate effect if I inhale or use them. But they're going to have a bigger impact upon my life if I truly believe, and that comes to surrendering as well. So everybody can heal, right? It just is dependent upon a multitude of factors. And so that's another question I get asked is, what will what are these multitude of factors that can impact my healing, right? If I have low back pain or neck pain, how come I'm needing to do these restorative practices? Or how come I'm needing to meditate? Or can I just do stretches and get better? That's why having a team of people to work with, not that you have to see them all, every week, but having a team of people at least to consult with, whether it be nutrition to help the tissues heal, or an aromatherapist to help, and naturopath to help bring in plants to help promote healing and change patterns of thinking, physical therapist to help with the more physical aspect, yoga teacher to help with the holistic aspect, all these things sorry, I'm just looking at some of the questions that were coming up. So all of these things will impact the healing if you're just doing stretches. So if you're just focusing on the physical first, let's say, for example, but for neck pain, but you don't really change the patterns of movement, which can come from the patterns of thinking, then, you know, the injury may return. So like for me, because I have this gene thing, right, I have a high risk for the big C coming back, for getting sick again. However, I'm trying, and I'm, again, only human, it may happen, but I am trying to decrease my risk by working on how I'm thinking, you know, because that gets more to the root of the nature. And in yoga, there's something called the 5 layers or the 5 koshas of healing, and as well as amongst other things that can either speed up or slow down the healing process. But essentially you have to work with all these different layers to get the most effective long-term results so it doesn't come back. Or if, let's say, you're susceptible to low back injury, because I keep saying that because it's really common in our society, it's getting, I just lost my train of thought, it's getting to the root cause of what the source of the issue is. And it could be purely physical, it could be due to scoliosis, but you just never knew, no one ever told you, so you just don't know how to work with your curve, right? Or it could be also having to do with thought processes and fears that you're storing within, you know, that's contributing to the psoas being tight, for example, and that's always predisposing you to move a certain way, which puts you at higher risk for low back pain. So it's really the whole person, multitude of factors that will contribute to someone healing, and healing well, let's say, for example, or healing fully, or letting it go forever. Because, you know, that leads to another question is, you know, I have the same disc injury as my neighbor, let's say, for example. Why did they get better so quickly, and why am I still feeling pain, you know, six months later, a year later, years later? What's the difference? You know, why do 2 people with the same injury or the same surgery heal faster than the other? And again, it comes back full circle to all these things that we talked about. The belief, primarily, thank you, Shauna, our belief in our ability to heal ourselves, our belief in the people that we're working with, our belief in the methodology, our patterns of thinking, how we treat ourselves. All these things our nutrition, all these things will impact whether, you know, a simple disc bulge will reoccur in one person, the pain, or heal very quickly in another. And again, and it comes back to the very first question is, did I cause this injury? Is realizing that we're all human and we all have imperfections, and accepting and loving ourselves as we are, and not shaming ourselves or blaming ourselves for being who we are, but taking responsibility for our own healing and making changes within our control. So, you know, that's all that in a nutshell. So if you have any questions, please comment below. I will come back around and answer them later. If you have any ideas for topics for next week, please let me know. If not, I'll pick one. And again, this series is for you, so I think for everyone to get the most benefit of it, the more participation, the better. And we can all learn, myself included, since I'm learning on this journey, and I'd like to just share it with all of you. So thank you for tuning in, those of you that did hop in, and I'll see you all next week, Wednesday at 9 a.m. Pacific Standard Time. Okay, have a great day. Bye.